let's say we had that plan next year. What do you see the evolution of the other side of it?
So if you pass the bill that's in the House, which was just introduced, and it's HR 1976.
Okay.
If you pass that bill tomorrow, it would take 2 years, not 10 years. It would take 2 years for it to go live. And there's a really thoughtful 2-year transition. But I think what you're asking about isn't so much what would the 2-year transition look like. You're asking more about what would that mean for the people currently working within this industry. That's sort of more what you're asking.
Mm-hmm. Yeah.
And so there's a couple things to think about with that. The first is that most of the work is actually got nothing to do with healthcare, right? Most of the functions we're talking about are core insurance functionality, call centers, data processing, claim centers, all that sort of work. And the reason I'm framing it like that is because I used to work at a group called Rush Prudential Health Plans, which was half owned by Prudential and half owned by Rush. And then while I was there, Prudential nationally decided that they didn't want any more healthcare in their line of business. So this major insurance company. And so we watched Prudential extract itself from healthcare. We watched that. And I don't remember anybody being laid off from that. They simply took those core functions that I just listed off and they migrated them to property and casualty and to life and all these other things. And that's just my anecdotal experience, but the data shows that these jobs, most of the jobs we're talking about, have a 20 to 25% annual turnover. We're not, sure, there's some nurses and physicians in these organizations and other professionals who have much more longevity and stability, but most of the work, most of the people that we're talking about, those jobs have a 20 to 25% annual turnover, which means if you do nothing today, 2 years from now, more than half of those folks won't be in those jobs anyway. And the bills are thoughtful about this. So the bills have, income guarantee up to roughly $100,000 per year. If you're one of the folks who get displaced by this for up to 5 years, then unemployment. The bills have job training, job placement, and all of that stuff. But more importantly, if you think about this, one of the things that limits jobs in our country is the cost of healthcare, right? So if everybody suddenly has robust health insurance, physicians opening a new practice would have green fields of untapped markets where there's been no insurer or very few insurers, and they could go there and overnight have a robust, busy, thriving practice to pay back their loans rather than going into so there would be, and they would have to open a clinic, they would have to build a clinic, they would have to hire all the staff. So there would be growth within that part of healthcare. There'd be growth within healthcare because there's functions that we don't do today that we should be doing. You should have a doula when you're in labor, if you want one. There should be somebody who goes by the house of an 85-year-old shut-in and says, hey, how are you doing? Why are the dishes piled up? You don't have the dishes piled up. It turns out social isolation, which can be addressed by a non-physician, social isolation is a big predictor of hospitalization. So there's all of these, and that's just two little examples, but there's all of this work within healthcare that would create jobs, and then work outside of healthcare, right? Employers are constantly telling you that they have to, move overseas. I know a factory in Canada where they get their raw ingredients from the United States actually, and they sell their product in the United States. So they have to ship up to Canada and ship back to the United States, and they would gladly relocate most of their production into the United States, but it would drive them out of business because as much as that transport costs, the increment in healthcare benefits would be through the roof. And so they don't. So businesses that are outside the United States would relocate in, and businesses within the United States that are really struggling to grow when their healthcare benefits can be as much as their hourly wage would find less of an encumbrance to that. So, and then the last piece I would say about jobs, and this is maybe a little more cynical, is there's how many jobs are we talking about despite all these mitigations? 800,000, maybe 1 million, which is a lot of people. Right? But how many people change jobs today? Well, if you look back for the last 20 years, not counting the pandemic, every year, 20 or 30 million Americans are fired. And every year, 20, 30 million more Americans just change jobs. And then another 5 or 10 million, just leave the workforce because they age out or what have you. So every year for the last 20 years, we've had 60 million people changing jobs. Now we're talking about 1 million, 60, 60. So a million is, 800,000. It's still a meaningful number of people, but there are a number of reasons to think that that's a well mitigated number. And oh my God, we have to do this. We have to do this.
It's
I
amazing.
think my
Go ahead,
best
Randy.
recollection of the estimate on either uninsured or underinsured Americans puts it at about 50%. And what's overlooked in that number, I think, is the number of those people who are already being crushed by so-called medical debt.
Yeah.
That, of course, feeds on itself, and it eventually leads to a point where people lose their homes, lose their cars, they can't get to work, and now they're living on public assistance. So the potential to have a positive impact on the U.S. economy, I think, is substantial in that scenario because of exactly that, the number of people that are pushed into the officially impoverished population simply because they couldn't pay their bills. And that happens way more, I think, than most people realize.
I had a surgeon a few weeks ago actually tell me that he did some, I forget what the operation was, it's not germane, he did some large operation on the patient as an inpatient, found out the patient was uninsured. He chose not to bill the patient, and he told the patient, I'm not going to bill you a penny, it's free. Saw the patient a few weeks later. The patient was struggling on the edge of eviction because the hospital didn't write off the bill.
Right. Mm-hmm.
So we, the physicians, do the work gratis.
Mm-hmm.
I thought
Look, we know too that's partly built into the insurance company model. They know that X number of dollars are going to be written off by doctors. They're going to do it pro bono, and that's just part of their model too. Shame on them.